try to go ahead and get started here. We have about 30 people registered for this, so we're going to try to get started. We may have some people jumping on as we get through. I have everybody pretty much locked out for video, and I'm hoping to have people locked out for video in your mute for now, so we don't get any distractions. So I'm going to try to share the screen here and go through some slides and sessions here for you guys, so we can hopefully get this presentation going. I don't know if you guys have used Canva before. That's kind of new. I'm kind of new at using Canva for presentations, but it's pretty nifty. So I'm going to, hopefully you guys can see the screen and see what we're doing here. Let me see. Just a few more seconds. Screen is good. Sounds like everything's good. We're going to get started. Maybe some people jumping in. So I'm going to try to talk about DPC employers and some of the terminology that you guys might hear as you talk to employers, you talk to benefits advisors. So some of the things you may hear that may be confusing, you know, when I'm on perusing the DPC Facebook page for DPC docs, these questions get asked a lot. So I'm going to try to just work through some of these. I have, I think, seven terms we're going to go through today, and then some time for some question and answers. And we'll try to get this wrapped up pretty quick and let you guys enjoy an awesome weekend. If you don't know who I am, Dr. Shane. I'm a DPC doctor here in Anderson, South Carolina, and doing direct primary care for about 7 years. And we have had experience with several larger employers doing direct primary care and lots of smaller employers. So we've had a lot of interactions with employers and speak to a lot of other DPC docs across the country who are trying to integrate employer health into their DPC practice, and working with benefits advisors. Trying to connect all those folks together can be quite difficult. So trying to work through some of that stuff. That'll be helpful. So our goal is to hopefully review these terms that are common to employers, and the little asterisk there is about these are we're mainly talking about large employers. Smaller employers, less than 50 employees, are not really required to have insurance. They may have insurance and they may be working with benefits advisors, but most of what we're talking about today is going to apply to larger employers that are required to have insurance, and they're either doing a fully funded plan or self-funded plan, which are terms we'll get into. Then we'll try to do some question and answers, and then some information where you can connect with me later if you need to. So the first thing we're going to hit today is a fully funded plan, which you may have never heard of that term. But basically a fully funded insurance plan is the typical insurance plan that everybody thinks of when they think about health insurance. You may hear the term of BUCA, but basically what you're talking about here is Blue Cross, United, Cigna, Aetna, Humana type plans, which are the major insurance plans across the country. PPO plans, but they can have HMO plans. There's all kinds of different kinds, but it's the big boys, the big insurance companies provide these fully funded plans where basically the insurance does all the work. You pay your premium, there's copays, there's deductibles, and you know the employer doesn't really do anything except sign up for the plan every year. So for them, it's sort of low risk. It's just they pay the premiums, they take money out of the employee's check for their percentage, and they pay the plan, and the plan runs everything. There's typically higher costs, and those premiums can go up every year, and that's what gets a lot of employers in trouble, because every year the premiums keep going up, deductibles keep changing. So it's sort of easy for the employer because they just sign those contracts and keep going. And if there's a problem, it's an insurance issue. These plans typically just don't work well with DPC because they're expensive already, and there's no way to really carve out direct primary care to put it into a primary care plan. So you're just really taking direct primary care and putting it on top of an already expensive plan. So not really great. You're seeing more and more larger employers move away from these type of plans and go to our second term today, which are self-funded plans. So we're seeing more and more larger employers go into a self-funded type plan. So these can be a fully self-funded or partially self-funded. Typically, when you hear people talk about a self-funded plan, they're mostly talking about partially self-funded plans. A fully self-funded plan would be one where it's a massive company and they pay for every bill that comes in. So any cancer bill, big major surgeries, transplants, they're basically paying fully for everything. So not a lot of companies or employers are doing, fully funded plans. Typically what you would see is a partially self-funded plan, which is the employer still is the insurer in these plans. The employer basically uses their money, their resources to pay the claims or put out funds to pay the claims for their employees. When they're partially self-funded, they set a limit on those claims and how much they're going to pay out of pocket. If it's a small employer, it might be $50,000. If it's a large employer, it might be $100,000. And then they use stop loss insurance, which we're going to cover here shortly, to cover any claims larger than whatever they set their limit. So they use a third-party administrator to handle these claims. We're going to talk about that in just a minute. And so they're not like an employer is not getting all these claims coming into their office and, oh gosh, here's one from the cardiologist. So, and they're just trying to handle all these claims. They use a company to help them manage all the claims. So the advantages here are that they're lower cost. So there's less administrative burden usually. So the costs are usually lower. They're super flexible. So these, with a really good benefits advisor, these self-funded plans can be crafted to direct patients to really good surgery centers, to DPC clinics, to use certain medications that may be better than others. So they're super flexible. And the employer has a lot of ability to make the plan fit best for their employees. You also get a lot more information from these plans, so they can see all the claims data. They can see, we had 10 patients go to this hospital and get gallbladder surgeries for 10 times what it would have cost at another facility. So you get a lot more information out of it, so you can continue to make your plan better for your employees and less costly. So these plans are also DPC friendly. If you have an advisor who knows what they're doing, you can definitely wrap these plans around direct primary care, make primary care the foundation of the plan. So they're super helpful in that regard. And then I usually say that you really need a really savvy advisor to make these plans work with a DPC clinic. You have to know really what you're doing to craft these plans, use the right TPA, use the right stop loss insurance, to get a really good PBM, which we're going to talk about later. So yeah, it takes a lot of planning to get all those things to come together just right. And that's sort of why I named my book Magic Pixie Dust and Miracles, because it takes a lot of miracles to get it to work right. So third-party administrator. So these are companies who basically process medical claims for third parties. So self-insured employers would use this company to basically manage all their claims for them. The employer and the benefits advisor, you set up the plan how you want. How's the TPA going to play for claims? What deductibles, copays, and they just follow the guidelines that the employer sets. And so they're handling all the paperwork of the claims. There are third-party administrators out there that are transparent and offer flat fee pricing, so you know what your costs are right up front, and those are the ones that would be most helpful. Some employers end up using the same BUCA plans, these national carriers, to do their third-party administrator work, and it can be quite expensive. So you may have a self-funded plan, but it's administered by Cigna or Blue Cross Blue Shield. So we try to look for or recommend transparent third-party administrators that really want to work with benefits advisors and DPC clinics to help employers save money. So TPA might be a word that you hear a lot in the insurance world when you're talking about employers. So stop loss insurance is one we mentioned as well. So stop loss insurance is otherwise known as reinsurance. You may hear that term. It's basically a commercial insurance to protect self-insured employers from large health insurance claims. So the employer can decide the risk with the benefits advisor. They want to work together and say, hey, what's your risk level? If you're a smaller employer, it might be $50,000 or $30,000. Like, hey, we'll pay that out. We know that those claims, maybe it's very unlikely to have a claim up to $30,000, but in the event that we do, we're going to buy stop loss insurance to cover everything over that. So if somebody gets cancer, we're only out $30,000, and then the stop loss insurance is going to take over from there. The dirty little secret is in health insurance is that most of the BUCA plans, Blue Cross Blue Shield, and those companies, they use the same kind of thing. They use a lot of stop loss insurance inside their plans too. Everybody's doing it. So hopefully, if you hear that term stop loss insurance, that's what they're talking about. It's the big risk protection that employers are using insurance to protect themselves. So pharmacy benefits manager. Now, hopefully you guys won't see my head explode when I talk about PBMs. This has been in the news a lot. You may know a lot about PBMs. You've heard about them. Basically what they are is they're a third-party middleman for drug programs, for commercial health plans. So self-funded plans have these, but also regular fully funded insurance plans work with PBMs. And they're the dastardly, most conniving, craziest gangster thing that's ever been invented for healthcare, as far as I'm concerned. And they're basically a middleman between drug companies, manufacturers, and insurers. And you can spend 2 or 3 hours just talking about all the crazy stuff and how they get kickbacks and affect our healthcare system. There's billions and billions of dollars made by these middlemen who set the drug prices for all these insurance plans, but they also tell the manufacturers how much they're going to pay for their medicines, and the pharmacies how much they're going to pay for them. So they basically drive all the cost for pharmacy in the country. And there's 3 PBMs that basically make up about 80% or more of the commercial PBM percentage of the whole country. CVS Caremark, which is also owns Aetna, Express Scripts, which is owned by Cigna, and Optum RX, which is owned by United. So I hope you're seeing a pattern here. The insurance companies and these pharmacy benefit managers are all connected. They all own each other, and they're making billions and billions every year. So the point of that is there are transparent and upfront PBMs. You don't have to use one of these massive money-hungry PBMs. There are ways to use a different PBM that will be transparent and helpful. But these PBMs do give us doctors, physicians, a lot of headaches because they set the prior authorizations, they set the tiers, they tell which drugs you can get. They're making all the rules for these plans for the employers and for BUCA plans. So they are a massive headache. So need to know about PBMs and how they operate. You can go on YouTube. Dr. Eric Bricker has a really awesome 20-minute or so video on PBMs if you want to catch him on YouTube. But it's you just need to know that you'll see this and how they affect DPC and how they're going to affect. If you get a large employer, it's really going to weigh on how you try to help your patients. So health savings account. So HSAs have been the sort of the bane of DPC for a long time. This question comes up at least every 2 or 3 months. Everybody wants to know about HSAs and why we can't use them. It's constantly a question. There are employees. We have 2,300 employees that are patients that are in our clinic, and they do use HSAs in our clinic. We never advise them on what to use when that for payment. But HSAs are basically employee owned. They're owned by the employee, so you can carry them with you. And these are tax savings accounts for medical expenses, and the IRS determines what those medical expenses are. And as you should know, the IRS basically says DPC monthly memberships are not a covered medical expense. There's a lot of confusion about that. President Trump tried to do a executive order and tried to get them to change this, but the IRS wouldn't change it. They want a law. They want a new law from Congress to fix that. So the best thing to do is know that HSAs are used all the time for DPC. We don't recommend, I don't tell DPC clinics, say, yeah, tell them to use HSA. And most benefits advisors are aware of HSA and the difficulties with direct primary care. You have to use it with a specific health insurance plan as well. So there's some rules and limitations that make it a little bit difficult for the HSA when you're dealing with DPC. So health reimbursement account, a little bit different. We're seeing more and more of these plans come around because there's some newer plans for smaller employers called ICHRA and different things that these are employer-owned savings accounts that they can put money into for medical expenses. And then it's a use it or lose it type account, and the employer decides how they would work. So you basically set up a plan that goes with the insurance plan, and the employer decides how they can use those accounts. There are ways to make HRAs work cleanly with DPC. That's more of a legal issue, and benefit. You got to have a really good benefits advisor to make those things work. But they definitely work well with DPC, and there are ways to make it work. So a little bit different than the HSA, but they're out there and they're gaining more popularity. So we'll probably see more of the HRAs coming along unless something changes with the government and they pass a HSA type plan that's clearly safe for DPC. And I think this is our final one, number 7, flexible spending accounts. So I have one of these myself. And these are also ways to put away money tax-free. They're not associated with any kind of insurance plan. So I have like a health savings plan for my insurance or my catastrophic care. So I have a FSA through my employer, through our company here. And I can put money aside and to pay for certain things throughout the year, for medications or dental visits and that kind of stuff. It is use it or lose it. So you got to spend it by the end of the year. It does not roll over. And it's not in any kind of growth account like a HSA could be in, like a savings account where you draw 0.5% interest or something. So this one's just the money is sitting there. And so some people like to use these. There's different ways you can use the FSA, even to help pay for childcare and different things. So they can be helpful to some people. So just be aware how those, you might see those, and some people do pay their DPC memberships through the FSAs, and that's basically the employer has to set that up right to make it work right, to use the FSA for DPC. So I think we're going to stop there, and let me get out of this. Screen if I can. And then if you guys will, any questions and stuff, let's use, I'll try to unmute you guys if I can. If you want to give me a question in the chat, Trying to see if I can get this off of this screen and make you guys bigger somehow, but so we have 6 folks here. I'm gonna see if I can pull up this chat here. And if anybody has a question over those topics, let's put it in the chat. I can also I can unmute people and try to get you guys to ask your question live if you want. Just let me know. I only see 1, 2, yes, 6 folks here, looks like. So we got one question. How do you go about finding a broker who will work with you? DPC is newish in my area, and people are very insurance married at this time. Kind of 2 questions in one there. So thank you for the question. The finding a broker is tricky. So what I recommend is try to attend as many DPC, free market medical association type events as you can, where there are other brokers in a free market community. Try to talk to as many DPC docs as you can. Say, hey, what brokers or advisors have you worked with? In our area, I'm in the South Carolina area, so I have a couple of really DPC knowledgeable brokers in our area that work. There's a organization called Mitigate Partners, and I think it's mitigatepartners.com or something. They're insurance advisors, benefits advisors, and they have some folks all across the country that really work really well with DPC advisors, with DPC docs and employers doing self-funded plans. And then have Health Rosetta. I don't know if you heard of that organization, Health Rosetta. I think it's healthrosetta.org. They have some advisors map where you can see, hey, if they're Health Rosetta, they do a certification for advisors that is helpful because they really try to focus on working with DPC and making primary care important and all these transparent PBMs and TPAs. But you can find some of their advisors, but you really need to vet. I don't care who it is, who you talk to. In my book, I talk about the questions you need to ask benefits advisors. Have they done self-funded plans before? Have they worked with DPC before? A good question to ask a benefits advisor is, who's your doctor and do you use a DPC? So, the local advisor that we partner with a lot here is out of North Carolina, and she actually has a DPC physician that she uses. So that's a good question to ask. Going to some conferences, like there's Nuts and Bolts conferences coming up in, I think it's December 10th through the 12th in Dallas. That's for patient care, Nuts and Bolts conferences. There'll be some advisors there. So some of the conferences like Free Market Medical Association and DPC Summit that the DPC Alliance puts on, frequently we have advisors and people who have worked with employers. So you want to connect with those people and say, hey, what advisor did you work with? So it's really getting out there and talking to other people and see who they've met with. The difficult part of your question is, people in your community, they're really attached to insurance. Employers think you have to have insurance. You gotta have insurance. That's a different mindset question, and you almost have to have a really good benefits person that you can work with to begin to educate people and change people's minds. It's basically until they get financially in a position or to where they really, really want to change or have to change, I don't know that many things will make a difference. So they have to be really ready to change to a self-funded plan that'll work with DPC. So that can be quite difficult for a lot of people to make that change. So you just have to keep pushing it, and try to see if you can find a local advisor that's willing to work on some of these self-funded plans, to make a big push. Let's see, I don't see any other questions. I'm going to go to this screen, just in case you guys want to get my information. I want you guys to have it. I'm still going to hang around for a little bit and answer questions. But if you want to email me a question, you can, drshane@dpcmagic.com. I have a little Facebook group, DPC Magic on Facebook, that I put little tips on there. You can hang out there. You can ask people questions, and you can hear from other DPC docs around. And there's some benefits advisors on that page too. And then if you're interested in looking at learning more about my book, it's at dpcmagic.com. You can find that too. So you can email me questions later if you want to. I'm going to try to post this conversation or video on the Facebook page and LinkedIn and a couple of places. So ICHRA is a newer, someone asked about what is ICHRA. So it's sort of newer, and I'm no insurance broker specialist, but they're plans that have been designed to help smaller employers do HRA type insurance plans. So they're really new within the last couple of years, and we don't have anybody that's using that yet. I haven't seen anybody using that. The benefits folks that I work closely with haven't really designed any of those plans yet. So they're kind of so new. I don't see how they've functioned yet. I don't know how they function, but it's basically doing insurance plan with a HRA. So we've never experienced them, so I can't give you a whole lot of information. But you can, there's plenty of websites that'll basically explain, how they operate. But it's a pretty cool concept, and we're hearing rumblings of certain self-funded and benefits advisors starting to craft some of those plans. So which could be very interesting, especially for smaller employers. Even if you got 30 or 40, or maybe even 50, 60 people who you want to provide some kind of plan for, and you can wrap that around with a DPC. So that would be quite helpful. Any other questions? And you guys can also email me. I'm going to try to stop. Got another question. So I'm not worried about specific questions, issues, or anything. There's a question on here about doing some integrating of a company with DPCs. I'll try to see if I can hang out with you and try to answer that, or try to talk to you a little bit about that. So thanks for you guys stopping by. It's we've been going for about 40-50 minutes, so you should have the email there if you want to email me other questions. Hopefully it's been helpful. I'll try to continue to do some of these moving forward. I also do on YouTube, LinkedIn, and the Facebook page. I try to do a little 5-minute Friday tip where I take questions from the DPC page, or people email me questions, and I'll try to answer those questions. So you can keep a look on that. And I'll be at the Nuts and Bolts Summit if anybody's coming in Dallas next month. Hope to see you guys there. I'll be hanging out with copies of my book and different things. So trying to help guide people through working with employers and benefits folks, and trying to connect people with benefits advisors if I can across the country. So hope you guys have an awesome Friday and a weekend, and email if you got questions. And thanks for stopping in. We'll see you next time.